So the next speaker up is Enrico Fiore from the University of Padua in Italy. And he's talking about ultrasonography of the rumen wall as a potential diagnostic tool to diagnose subacute rumen acidosis in fattening bulls.
Thank you, Chairman, for your presentation, and thank you to the World Buiatrics Congress to give me the opportunity to present my research here. And my research is on the relationship between the ultrasound of the rumen and the relationship between the rumen pH, especially in condition of acidosis. But first of all, I have to say that in Italy, we used to import more animal from other countries, and this is a common practice in intensive system of beef cattle. Generally, we used to import these animals from France, Ireland, or East Europe. And as you can understand, after 8 or 12 hours of travel by truck or by boat, this animal, when arrived in Italy, have an acclimatization period after restocking. This is most important for two reasons, because after transporting this animal are in stress, and in second, because this animal change diet from a pasture diet to an high concentration diet. Ruminal acidosis are the second economic problem after respiratory disease in Italy. And we can define ruminal acidosis as a metabolic disorder that negatively affects ruminal fermentation, animal health, production, and as a consequence the corporate profit of the industries. In a few words, the ruminal acidosis, we can define ruminal acidosis, main factor can influence the decrease of rumen pH in those animals, but the first but the biggest problem that we have in Italy is the difference and the changes of diet. In fact, diets with high concentration of starches or concentrate feed cause an increasement of rumen fermentation and higher presence of the volatile fatty acids, VFA, in particular propionic acid. From the literature, we can classify the acidosis in acute rumen acidosis when the pH is lower than 5.5, and subacute rumen acidosis when the pH is between 5.5 and 5.8. Where is the effect of the acidosis? Acidosis have more effects on the animals. We can have animals with diarrhea or diarrhea with the presence of undigested food, laminitis, decrease in production, especially in dairy cows, decrease in feed intake, weight loss, or BCS loss. But the effect that we want to take in consideration for our research is the effect that acidosis give directly on the mucosa. In fact, in more animals and in more research described that acidosis cause parakeratosis, rumenitis, and mucosal inflammation. This is our picture that we have done in our university. And in literature, there are not more studies that give us the opportunity to explain if this phenomenon is very, very common. The only studies that use ultrasound to measure the thickness of the mucosa describe that the thickness of the rumen wall in the healthy animals is between 3 and 4.8 millimeters. The aim of this study was to evaluate the viability of the ultrasonography on the rumen mucosa as a suitable diagnostic tool to identify beef cattle affected by acidosis. In this study, we used 154 animals selected in a big farm of 2,500 beef cattle. The breeding of these animals was Charolais. These animals, the mean weight of these animals were 425 kilograms, 12 years old, and when this animal arrived in Italy, had a fibrous diet for 5 days prior the high concentrated diet that usually we give after 5-7 days in Italy. Rumenocentesis and ultrasonographic examinations was performed on the same parts of the animals. Usually we used to make rumenocentesis on the ventral sac, of the rumen, 15-20 centimeters caudal ventral to the costal contral junction, and after rumenocentesis we have performed the ultrasonography. Individual rumenocentesis were carried out 4-6 hours after feeding in 3 days, at 10 days after housing. The rumen fluid was collected in a spinal needle, and 15 milliliters of rumen fluid were collected from each animal. Ruminal pH was measured immediately after sampling directly in field using portable pH meters. And the rumen wall was evaluated by a portable ultrasonographic scanner. You can see in this picture how the mucosa is different. For example, in this animal, we have a mucosa of 1 centimeter, and here, but the image is not very well, 0.5 millimeters. And the images obtained were analyzed with the software MyLabDesk-1. One way ANOVA was performed to detect the difference between the parameters measured on the animals. We have done a regression analysis and a Pearson correlation for analyze if the thickness of the mucosa or the rumen wall is in correlation of the tendons with the lowering of the pH. We have done a rock analysis to identify a cutoff for these relations, and the first result is pretty interesting because we have differences between the 3 groups. The healthy groups with the pH is higher than 5.9 in SARA group and in acidosis group. But the most important thing is that 41% of these animals at the arrival of in the farms show the rumen pH lower than 5.8. These animals are in condition of SARA or acidosis. And the regression model that we have done, a linear model, show that the animals that have a pH lower than 5.8 show an increasing of thickness of the total mucosa. Here we can see the total mucosa. As you know, mucosa is composed by 4 layers, mucosa and submucosa that is undistinguishable. The muscular is part of the abdomen of the rumen wall and the serosa. And the same things is for the mucosa. Animals that showed pH lower than 5.8 showed a thickness of the mucosa higher than 5.5 millimeters. The Pearson correlation confirmed the results that we have found on the regression curves, and we can see that the thickness of the rumen wall, the thickness of the mucosa, have a negative tendency with the rumen pH. And obviously, the rumen wall is direct correlated, positive correlation. We have a positive correlation with the mucosa of the rumen. From the rock analysis, we have good results because we have 85%, 81% of sensitivity and specificity for the thickness of the rumen wall. For values in animals, for values of measured than 7.8 millimeters in animals that have pH lower than 5.8 in condition of acidosis. And regarding the thickness of the rumen mucosa, we have animals that showed a thickness of the mucosa higher than 5.9 with a sensitivity and specificity pretty well. In conclusion, we can say that at the arrival, the animal can suffer the acidosis in the barns, and the thickness of the ruminal wall and the ruminal mucosa are correlated with the lowering of the ruminal pH. Ultrasonography is considered a non-invasive diagnostic tool for diagnostic SARA or acidosis if we compare the rumenocentesis with ultrasound. And I hope that this study provides encouraging preliminary data for further examination, further validation, maybe further software that permit us to detect in the barns directly the thickness of the mucosa and as a consequence maybe SARA or acidosis. I thank you for your attention, and if you have any question, I'm here.
Actually, we probably will also not have the questions now because we're trying to catch up.
Oh, sorry.
So if there's any questions afterwards, maybe people could up and ask you then. Is that okay?
Thank you.